Bones of wrist and hand. Bones of wrist. The bones of carpus or wrist are arranged in 2 rows. They are: first or proximal row made of scaphoid, lunate, triquetral and pisiform bones. Second or distal row made of trapezium, trapezoid, capitate and hamate bones. Bones of palm. They are made of scaphoid, lunate, triquetral and pisiform bones. They are long bones which contain a head, a shaft and a base. The bases articulate with the distal row of carpal bones. The heads articulate with the proximal row of phalanges. Bones of fingers. They are made of phalangeal bones. These are long bones. The thumb has 2 phalanges. Other fingers have 3 phalanges. They are proximal, middle and distal phalanges. Metacarpal phalangeal joints are the joints between metacarpal and phalangeal bones. Interphalangeal joints are the joints between phalangeal bones themselves. Bones of thorax. The skeleton of the thorax is made of the following bones. Sternum in the front. 12 pairs of ribs at the sides. 12 thoracic vertebrae at the back. Sternum, it is also called as breastbone. It is a flat bone which is divided into 3 parts, namely manubrium sterni, body of sternum and xiphoid bone. Manubrium sterni, it is the upper part which is triangular in shape. It contains clavicular notches on both sides. These notches articulate with clavicle. Suprasternal notch which is present in between the 2 clavicular notches. Articular surfaces on both sides for the first rib. Body of sternum, gladiolus, the second rib is attached at the junction between manubrium sterni and body of sternum. This junction is called as angle of Ludwig. The body of sternum has attachments for 3rd, 4th, 5th, 6th and 7th ribs. Xiphoid bone, ensiform process. It is the lowest part of sternum. To this are attached the diaphragm, linea alba and rectus abdominis muscle. Ribs, they are arranged in 12 pairs, on the back side, all of them are attached to thoracic vertebrae. Depending on their attachment in the front, they are classified as true ribs, which are the upper 7 pairs. They are attached to the sternum directly. False ribs, which are the lower 5 pairs. They are attached to the sternum indirectly, through costal cartilages. Floating ribs are the lowest 2 pairs. They are not attached in front. A rib consists of the following parts. Anterior or sternal end, it has depressions for attachment of costal cartilage. 2. Posterior or vertebral end, it has a head, neck and tubercle. 3. Shaft, which has a. 2 surfaces, namely inner and outer surfaces. b. 2 borders, namely upper and lower borders. c. Subcostal groove present in the inner surface. It contains intercostal vessels and nerve. Costal cartilages, these are bars of hyaline cartilage. They connect the ribs and sternum. Vertebral column, the vertebral column or spinal column is made of a number of bones. These bones are called vertebrae. In all, there are 33 vertebrae. Classification of vertebrae, according to the region they occupy, the vertebrae are classified as cervical vertebrae, 7 in number. They form the neck region. 2. Thoracic vertebrae, 12 in number. They form back of thorax. 3. Lumbar vertebrae, 5 in number. They form lumbar region. Costal cartilages, these are bars of hyaline cartilage. They connect the ribs and sternum. Vertebral column, the vertebral column or spinal column is made of a number of bones. These bones are called vertebrae. In all, there are 33 vertebrae. Classification of vertebrae, according to the region they occupy, the vertebrae are classified as cervical vertebrae, 7 in number. They form the neck region. 2. Thoracic vertebrae, 12 in number. They form back of thorax. 3. Lumbar vertebrae, 5 in number. They form lumbar region. 2. Neural arch, which is the posterior part. It contains A. Two pedicles which project backward and B. Two laminae which are directed backward to meet behind in the midline. 3. Two transverse processes, one on each side. They lie in the junction between pedicle and lamina. 4. One spinous process which is a backward projection. It occurs where the two laminae unite in the midline. 5. Two articular processes, in the upper and lower surface. They lie at the junction between pedicle and laminae. 6. Neural canal which is a circular opening. The spinal cord passes through this. A. Two pedicles which project backward and B. Two laminae which are directed backward to meet behind in the midline. Cervical vertebrae, they are 7 in number. The first cervical vertebra is called as atlas. The second cervical vertebra is called as axis. These two cervical vertebrae have different structures when compared with others. Atlas, it is the first cervical vertebra. 1. It does not have a body. 2. It does not have spinous process. 3. On the upper surface, it has two facets. These facets articulate with the condyles of occipital bone. Axis, it is the second cervical vertebra. It contains 1. Odontoid process which is an upward projection from the body. It articulates with anterior arch of atlas. 2. Two facets on the anterior surface. They articulate with atlas. 3. A spine which is small and bifid. Other cervical vertebrae, they are the lower 5. Their features are a smaller body, oblong shape, triangular neural canal, bifid spinous process, vertebral foramen in the transverse process. Thoracic vertebrae, they are the 12 in number. These vertebrae carry the ribs. The characteristic features of these vertebrae are: body is heart-shaped. Body has facets, one on each side for the attachment of head of ribs. The transverse process has facets at the tips for articulation with tubercle of ribs. Vertebral foramen is absent. Pedicle and laminae are absent. Spinous process is long and projects downwards. Lumbar vertebrae, they are the 5 in number. They have the following characteristics. Body is big and kidney-shaped. Spinous process is short, stout and directed backwards. No articular facets for ribs. Pedicles and laminae are present. Sacral vertebrae, they are the 5 in number. All of them unite to form a single bone called sacrum. The sacrum joins with the pelvic bone and takes part in the formation of pelvic cavity. The features of sacrum are: 1. Sacroforaminae which are 4 openings present in the anterior surface. Nerves pass through these openings. 1. Sacroforaminae which are 4 openings present in the anterior surface. Nerves pass through these openings. 2. Lateral masses on either side. They are formed by the union of transverse processes. 3. Sacral promontory which is the projection of the upper part of sacrum. Coccygeal vertebrae, they are the 4 in number. All of them unite to form a single bone called coccyx. Ligaments, the vertebrae are held together by the following ligaments. 1. Anterior and posterior ligaments, they run the whole length of spine. They connect the anterior and posterior aspects of the bodies respectively. 2. Ligamenta flava, they connect the laminae of vertebral arches. 3. Supraspinous ligaments, they lie between the spines and connect them. 4. Intervertebral discs, they are made of fibrocartilage. Bones of the pelvic girdle. The pelvic girdle is the connection between the trunk and lower extremities. It is formed by 1. Two innominate bones, one on each side. 2. The sacrum and coccyx in between. Innominate bone, it is called as pelvic bone or hip bone. It is made of 3 parts, namely ilium, ischium and pubis. All these 3 bones unite to form a large cup-shaped cavity on the outer surface called acetabulum. The head of femur fits into acetabulum forming the hip joint. Left innominate bone, external and internal surface. Ilium, it is the upper expanded and flat part of innominate bone. It contains 1. External or gluteal surface. This surface contains 3 ridges, namely superior, middle, and inferior gluteal ridges. They give attachment to gluteal muscles. 2. Internal surface, which is concave. It forms part of iliac fossa and it gives attachment to iliac muscles. 3. An upper margin called as crest of ilium. The crest of ilium contains 4 spines. They are: A. Anterior superior iliac spine. B. Posterior superior iliac spine. C. Anterior inferior iliac spine. D. Posterior inferior iliac spine. 4. Great sciatic notch, which is below the articulating surface for sacrum. Pubis, it is the front portion of innominate bone. It contains 1. A body which is more or less square in shape. 2. Symphysis pubis, which is the union of the pubic bones in the front. 3. Superior ramus, which is a bridge of bone projecting from the outer part of body and joins it to ilium. 4. Inferior ramus, which is the lower part of the body and joins it to ischium. Ischium, it is the solid, broad portion at the lower and back part of innominate bone. It contains 1. A body which forms acetabulum on the outer surface. 2. Tuberosity of ischium present at the lowest point. It supports the body weight while sitting. 3. Spine of ischium, which arises from the back of ischium. Obturator foramen is a roughly triangular opening which is bounded by 1. Pubic bone in front and above. 2. Ischium behind and below. Parts of pelvis. Pelvis can be divided into 1. False pelvis, which is the upper part. It is formed by the 2 iliac bones. 2. True pelvis, which is the lowest part. It is formed by ischium and pubis, in the front and on each side, and by sacrum, behind. Pelvic brim is the upper opening of true pelvis. Iliopectineal line is the line present at the junction of ilium with ischium. Differences between female and male pelvis. The female pelvis is adapted for pregnancy and childbirth. It differs from male pelvis in the following aspects. 1. It is shallow and wider than male pelvis. 2. Inlet and outlet are longer and nearly oval in shape. 3. Bones are lighter and smoother. 4. Pubic arch is wider. 5. Ischial tuberosities are further apart. 6. The coccyx is more movable. Bones of lower limb. Femur, it is also called as thigh bone, it is the longest and strongest bone of the skeleton. It contains 2 extremities and a shaft. Upper extremity, it contains 1. Head which is spherical and covered with hyaline cartilage. 2. A neck which lies below the head. It is long and flattened. 3. Greater trochanter, which is on the outer side where the dot neck joins the shaft. 4. Lesser trochanter, which is on the inner side where the neck joins the shaft. 5. Anterior and posterior intertrochanteric lines are 2 lines which unite greater and lesser trochanters. Shaft, it is smooth, cylindrical and rounded in front and at the sides. It contains 1. Linea aspera, which is a ridge on the posterior aspect. 2. Gluteal ridge, which extends from linea aspera to the back of greater trochanter. 3. Spiral line, which extends at the inner aspect from linea aspera to lesser trochanter. Lower extremity, it contains 1. Medial and lateral condyles lying 1 on each side. 2. Intercondylar notch which lies behind. It separates these 2 condyles. 3. Adductor tubercle, which is a small tubercle above the medial condyle. 4. Patellar surface, which separates the 2 condyles in front. Patella rests on this surface. 5. Popliteal surface, which is above the condyles at the back. Popliteal vessels and nerves lie on this surface. Patella, It is a sesamoid bone developed in the tendon of quadriceps femoris muscle. It contains 1. An apex pointing downwards. The ligamentum patelli is attached to the apex. 2. An anterior surface which is rough and covered with a bursa. 3. Posterior surface which is smooth. It articulates with patellar surface of femur to form knee joint. Tibia. It is the innermost bone of the leg. It is a long bone containing 2 extremities and a shaft. Upper extremity. It contains 1. A head which contains 2 condyles, namely medial condyle and lateral condyle. The upper surfaces of these condyles articulate with the corresponding condyles of femur. 2. Popliteal notch which separates the 2 condyles at the back. 3. Tubercle of tibia which lies below the condyles in the front. Shaft. It is triangular in shape having 3 borders and 3 surfaces. The shaft contains 1. Crest of tibia which is present in the middle third of the anterior border. 2. Sotial line which is a strong ridge of bone present in the posterior surface. Lower extremity. It is slightly expanded. It has an articular surface for talus to form the ankle joint. Medial malleolus is a downward projection present in the medial aspect. Fibula. It is the lateral or outermost bone of the leg. It is a long and slender bone. It contains 2 extremities and a shaft. Upper extremity. It contains 1. A head which is expanded. It articulates with the back of lateral condyle of tibia. It does not take part in the formation of knee joint. 2. Styloid process present in the apex of head. 1 ligament of knee joint is attached to this shaft. It is thin and gives attachment to several muscles. Lower extremity. It contains 1. Lateral malleolus which is a downward prolongation of the lower extremity. 2. Malleolar fossa which is rough depression behind the malleolus. Bones of foot. Bones of foot can be classified as 1. Tarsal bones, 7 bones. 2. Metatarsal bones, 5 bones. 3. Phalangeal bones, 14 bones. Tarsal bones. They include calcaneum, talus, navicular, cuboid and 3 cuneiform bones. Calcaneum. It is the largest bone of the foot. It lies at the back of foot. Above, it articulates with talus and in front with cuboid. Calcaneum gives attachment to tendocalcaneus of calf muscle. Talus. It forms the central and highest point of foot. It articulates at the sides with medial and lateral malleoli and below with calcaneum. Navicular, or scaphoid. It is a disc-shaped bone. It is present in the medial aspect of foot. It lies between talus at the back and 3 cuneiform bones in front. Cuboid. It is in the lateral aspect of foot. Behind, it articulates with calcaneum. In front, it articulates with 2 lateral metatarsal bones. Cuneiform bones. They are 3 in number, namely medial, intermediate and lateral cuneiform bones. Posteriorly they articulate with navicular bone. Anteriorly they articulate with 3 metatarsal bones. Metatarsal bones. They are 5 in number. They correspond with the 5 toes. All of them are long bones. They contain a head, shaft and base. The first metatarsal is thick and stout. The second metatarsal is longer than others. The 5th one has a projection at the lateral side of the base. Phalanges. They are 14 bones, 2 for the first toe and 3 for the rest. All of them are long bones. Arches of foot. In the foot, the bones are so arranged that there are 4 different arches. There are 2 longitudinal arches and 2 transverse arches. These arches are A. Medial or internal longitudinal arch. For this 1. Posterior support is given by calcaneum. 2. Anterior support is given by navicular, 3 cuneiforms and heads of 3 inner metatarsal bones. 3. Summit is provided by the talus. B. Lateral or outer longitudinal arch. This is formed by calcaneum, cuboid, and 2 outer metatarsal bones. C. Transverse tarsal arch, it is formed by the tarsal bones. D. Transverse metatarsal arch, it is formed by the heads of metatarsal bones.